As the number of primary care physicians entering the workforce plateaus, nurses are expected to play a more substantial role in providing primary care and managing the care of patients with complex health needs. That trend may prompt changes in primary care training in nursing schools and changes in reimbursement systems. I'm Stephen Morrissey, managing editor of the New England Journal of Medicine, and I'm talking with Thomas Bodenheimer, a professor of family and community medicine at the University of California, San Francisco, where he's the founding director of the Center for Excellence in Primary Care. Dr. Bodenheimer has co-authored a perspective article about the future of the primary care workforce. Dr. Bodenheimer, you write in your article that the number of nurse practitioners and registered nurses in the United States has increased dramatically over the past decade. What's drawing people to the profession, and how are nursing programs keeping up with that demand?
It's absolutely true that the number of nurse practitioners entering the workforce tripled from about 6,000 a year to 18,000 a year in 2014. And the number of registered nurses who are not nurse practitioners doubled between 2001 and 2013. And previously there had really been a shortage of registered nurses, but number one, nursing schools have increased their enrollments, and there seems to be a great demand among young people interested in healthcare careers to go into nursing. So in a way, it's very fortunate that because primary care physicians, the number of us is plateauing or even beginning to go down. It's very fortunate that there are more nurse practitioners and registered nurses available to provide a lot of the primary care to the population, which is, of course, growing and getting older.
So you write that in the future, physicians will probably focus on diagnostic conundrums and they will lead teams caring for patients with complex needs. But most patients will be seeing a nurse practitioner or a physician assistant as their primary care practitioner. Is that going to change the kind of people who are going into these nursing and PA careers?
I think the people who are becoming nurse practitioners and physician assistants really see themselves pretty much the same as physicians, even though they don't have as much training as physicians. By the time they've been on the job for 2 or 3 years, they're able to take care of probably 90% of patient needs. So I think a lot of young people who would like to become a primary care clinician and have maybe a tough time getting into medical school, which is very difficult to get into, they have an alternative to go to physician assistant training or nurse practitioner training and really end up doing almost the same thing as what a physician does.
And as you say in your article, the care delivered by nurse practitioners is as high quality as that provided by physicians, and it may cost less. Are the cost savings attributable solely to the difference in salaries between NPs and physicians, or does the kind of primary care delivered by the NPs affect the spending in other ways?
One thing that we've found is that nurse practitioners spend more time with their patients than physicians. And what that allows them to do is to discuss things with their patients in a little more depth. And that means that rather than okay, I only have 8 minutes with this patient, a physician might say, so the best thing for me to do is send them off to a specialist. The nurse practitioner may be able to take care of that patient and not be so anxious to send the patient to a specialist. Once the patient goes to a specialist, then there's this whole kind of cascade of tests and then finding out new things and so forth that costs a lot of money. So I think that's probably the reason.
So given the new responsibilities that NPs are facing, some one-year primary care nurse practitioner residencies have been created. How much interest among new graduates is there in these residencies, and is this a model for the future?
Well, we don't know for sure because these nurse practitioner residencies have just begun a few years ago. But one thing that a lot of physicians notice is that when a nurse practitioner comes out of her training, because she's had maybe 3 or 4 years of training as opposed to 7 years, for example, for a primary care physician, the nurse practitioners are not quite ready to take care of a panel of patients. So they usually takes them a year or so to kind of get up to speed. And what a nurse practitioner residency can do is to really help them to have another year of training that by the time they're finished with that, then they're really pretty close to being up to speed in terms of being able to really take care of the patients that they're responsible for.
So looking at RNs as well, they've been taking on expanded roles in primary care, particularly as chronic care managers. The focus of nursing education has traditionally been on inpatient care, not external chronic care management. Are nursing students receiving new kinds of training? Are nursing schools changing their curriculums?
It's interesting that you asked that because I actually just recently was at a conference put on by the Josiah Macy Foundation to discuss how nursing education needs to change to prepare nurses for primary care, which is very different than the skills that they need to be an inpatient hospital nurse. So the main thing that nurses need to do in primary care is to be what we call a care manager for people with chronic disease, which means that they would, number one, help people understand their disease, help them with behavior change, and under physicians' protocols to actually increase their medication doses as needed. So that's a whole different skill. So far, most nursing schools have not moved in that direction, but the purpose of this conference put on by the Macy Foundation was to try to persuade nursing schools, and there were a number of nursing school deans and faculty there, to begin to add primary care skills to their curriculum. We'll see if that really happens. Hopefully it will, because right now a lot of nurses need on-the-job training in primary care practices because they don't get ambulatory care training in nursing schools.
As nurses move into these primary care services, do you think that reimbursement systems are going to change?
Well, of course, that's really the biggest barrier to having RNs working in primary care. Nurse practitioners are paid under the fee-for-service system just as physicians are, but nurses can spend a lot of time with patients and really do a lot of the care for patients, especially with chronic diseases, and don't get paid at all. So we really need to change our payment mechanism. And little by little, it's changing. There are a couple of new Medicare fees that now will pay nurses to take care of people with chronic disease. And hopefully there will be the rapid implementation of new payment mechanisms that are more like capitation, that don't require a visit by a doctor, nurse practitioner, or PA to generate payment. We don't know exactly how long it's going to take for that to happen, but certainly Medicare is working very hard to help make these payment changes happen. And in order for nurses to really be able to work in primary care in a sustainable way throughout the country in many primary care practices, we really do need this kind of payment reform, and we're hoping that it's going to happen, but we don't know for sure.
Finally, are the shifts in primary care that you described, this move toward nurses and NPs, is this happening elsewhere in the world? What's going on in other countries?
In other countries, it varies. For example, in the United Kingdom, the National Health Service, almost every primary care practice or general practice office has what they call a practice nurse. And the practice nurses do a lot of the chronic care and preventive care, so that's been going on for a long, long time. Nurse practitioners are less common in other countries, but most other countries have many more primary care physicians per population than the United States. The typical European country and Canada, about half of all physicians are in primary care, whereas in the United States it's about a third. So they don't have so much of the need for new primary care clinicians as we do. But the RN role is more advanced in other countries in general than in the United States, and hopefully we'll catch up.
Thank you, Dr. Bodenheimer.